Today you're either here for the first time to meet me or you're here for your surgery. Many patients will forward their whole packet of information, including their scans, their heart workup, and their history of medical problems. I can review that long distance, and then they can make one trip with their family here for surgery. Others prefer to come for a consultation, to meet me, think about surgery, and then schedule in the future. Both ways work very well, and when you talk to Kelly, she'll kind of go through what is best for you and your family and how we can make the trip to Phoenix and your surgery as successful and easy as possible. When you come to our office, there's going to be a large team of people you're going to meet. Obviously, you're going to see me, and we're going to look specifically at what your chest wall issue is. You know, how can I best fix it? How many bars? What are the risks of the procedures? All of those really important surgical details that you want to know about. You're also going to see a lot of my other team. I have a tremendous number of people that will be working to give you information, to follow you after surgery, and to continue to help and follow you long distance as you go through the next few years with bars and when you need your bars out. Those include Kelly, who you've already met, who sets up and organizes things. They include a number of physician assistants. You're going to meet Lori today, who is exactly that. She's my assist. She helps me do everything. She helps take care of you. She sees you after surgery. She sees you before surgery and any problems you have. I also have a nurse, Marianne, who many of you have talked to by email and long distance, who will also be helping to follow you up after surgery with any concerns.
Hi, my name is Lori Gushu. I'm a physician assistant, and we're going to discuss today what to expect at your pre-op Pectus visit. First and foremost, we'll do a comprehensive history and physical, as well as give you pre-printed pre-op instructions. First, your surgical start time and the time we would like you to arrive at the hospital approximately 2 hours prior to surgery. Instructions such as nothing to eat or drink after midnight. You may have whatever you want with no restrictions for dinner or an alcoholic beverage if preferred. We will give you 2 scrub brushes to use, one the night before, one the morning of surgery. It's an antiseptic soap that we use in the operating room prior to going into the operating room. We also discussed your current medication list and any medications that are pertinent and that you need to take prior to surgery with a sip of water, such as a beta blocker, H2 blocker, or PPI. You also have a blood band on, which needs to stay on prior to surgery and not be submerged into water. Lastly, we'll send you upstairs to our 3rd floor for preoperative photos, in which we'll also get postoperatively, so we have something to compare pre and post. Next, we will discuss the pre-op medications you will receive after talking with the anesthesiologist prior to rolling back into the operating room. First, IV dexamethasone, which is used to help prevent nausea. Next, Celebrex, which is a non-steroidal anti-inflammatory, as well as gabapentin, which is for nerve stabilization. Lastly, we have started using Entereg, which is to help with post-op ileus. Anesthesia just doesn't put you to sleep, it puts your bowels to sleep, so it helps to prevent the side effects of narcotics.
The morning of surgery, you'll come to the main Mayo Hospital. You'll go right through the front doors, and on the right is admissions. Admissions will check you in. They'll take you up to the 2nd floor where you will get admitted, your IVs put in, and get ready for your surgery. You will see me right before surgery. I'll come in, make sure you don't have any questions. We'll talk to your family. We'll give them instructions of where they can wait for you, and then we'll take you back. We're going to take very good care of you. My entire team is there waiting to fix your defect. There's quite a few people in the operating room, all very important. We have nurses, assist, my first assist, Jesse, who's been with me for 15 years, anesthesia, cardiology, doing your echocardiogram, all of this to make sure your surgery is done safely.